never really been good at golf.
Or tennis. Look, I'm not an athlete, but people who are would tell you the perils of injury. There's this new treatment that goes by the name PRP. Athletes such as Tiger Woods, Rafael Nadal, and Kobe Bryant have sensationalized it due to its treatment of injury. So what is PRP, and why does it matter?
PRP is platelet rich plasma. It's this procedure where we draw the patient's whole blood and we spin the components down in a centrifuge, which is used to separate the various components, and we isolate the plasma, which holds the platelets, and we create a formula of platelet rich plasma, so part of the plasma that is dense in the platelets.
We took a closer look to see what makes up this substance.
Here you can see we've separated a couple of different components of the blood. So there you can see the red blood cells of the whole blood. That is the platelet poor plasma, this component here. And if you look real close, you can see a little white coat on the top of this red layer here. That's called the buffy coat, or the buffy layer. That is the platelet rich plasma, so that the components of the plasma have been separated out, and those are the growth factors that we really want to isolate and focus on.
Why are platelets important?
And the platelets are important because they have all of the patient's growth factors and cytokines that treat injuries. So if we make a very, very dense or concentrated form of these platelets, about 6 million times the patient's concentration within their whole blood, we isolate those and we inject it back into the injury, we can accelerate the healing of various types of injuries. PRP has been found to be very effective for treating the low stages of arthritis, so grades 1 and 2 of osteoarthritis, more effective than some of the other alternatives such as viscosupplementation or corticosteroids. It's also very good for treating certain types of muscle and ligament injuries, so muscle tears, and then also ligament or tendon injuries. An example would be a rupture of the Achilles tendon or Achilles tendinopathy, patella tendinopathy or patella tendinitis, and then also injuries such as hamstring muscle sprains and also hamstring tendinitis. There's also been a lot of literature published for elbow injuries, specifically tennis elbow and golfer's elbow, where PRP has outperformed some of the other treatments that we typically use for these injuries, such as corticosteroids.